Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Amphotericin B. Its brand name is Fungizone. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Amphotericin B. Then discuss some examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Amphotericin B acts on susceptible fungi by binding to sterols in the cell membrane, which alters the membrane permeability and results in the leakage of intracellular components. In terms of indications or reasons we prescribe this medication to a patient, well, I'll start off by saying that there are many indications. There's actually over 18 indications, but I'll just list a couple examples here on this slide. The one example would be for invasive aspergillosis or blastomycosis. This can also be used for candidiasis, also known as yeast infections, or for severe fungal infections of the central nervous system, as well as severe fungal infections of the lung. With respect to contraindications or reasons we would not be able to prescribe Amphotericin B, well, we just wouldn't give this medication to a patient who had a hypersensitivity to Amphotericin B or to any other component of the formulation. Now for some examples of dosing with Amphotericin B. So in the treatment of invasive aspergillosis, we may see 0.25 to 1 milligram per kilogram per day intravenously given over 2 to 6 hours. The maximum dose here would be 1.5 milligrams per kilogram when given on alternate days. And in terms of duration, well, it has ranged up to 11 months and a total dose of up to 3.6 grams. When treating a severe fungal infection of the central nervous system, we may see 0.01 to 0.1 milligrams given intrathecally every 48 to 72 hours initially, and then the patient may increase to 0.5 milligrams as tolerated. As with all medications, there are some side effects or adverse reactions that patients may experience while using Amphotericin B, so we'll go over some of those here now. Hypotension would be a common side effect, also known as low blood pressure, as well as thrombophlebitis. Injection site pain may occur, as well as diarrhea, indigestion, or a loss of appetite. Nausea and vomiting may occur with this medication, as well as anemia, arthralgia or joint pain, myalgia or muscle pain, as well as a headache, fever, malaise, or shivering. 3 serious side effects that would be less common with this medication would be cardiac arrest, cardiac dysrhythmia, or hypokalemia, low potassium. Alright everybody, that's all we're going to talk about today with Amphotericin B or Fungizone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.